Hello, everybody. So, in this chapter, we'll be talking about fluids, electrolytes, and the importance of pH balance in the body. If you are going into nursing, this is one of the most important chapters to understand. Probably learned about acid bases and buffers well before you got to anatomy and physiology, maybe in chemistry, and maybe in anatomy part 1 you might have come across the concept of pH, right? So what is pH? What do you understand by the term pH? Now pH, I'm looking for my pointer. Yeah, so pH is the measure of hydrogen ions in a solution. Okay, so when there's a lot of hydrogen ions in a solution, the pH becomes acidic. When there's not enough hydrogen ions, the pH shifts towards basic. Now this over here is the pH scale. The pH scale goes from 0 through 14, and the pH is used to specify how acidic or basic a water-based solution is. Okay, so acids always have a low pH, but they have a really high hydrogen ion concentration. Okay, so these solutions over here that are acidic have a really high hydrogen ion concentration, and basic pH or alkaline pH have a higher alkaline solutions have a higher pH, but the concentration of hydrogen ion is going to be low in these alkaline solutions. Okay, so right over here in the middle, a pH of 7 is considered neutral. Anything below 7 is going to be acidic, and anything above 7 is going to be basic. Okay, so let's look at what an acid is. Okay, now the electrolytes that dissociate in a solution, a water-based solution, and release hydrogen ions in the solution are considered acids. Okay, you have strong acids and weak acids. A strong acid like hydrochloric acid, they ionize very easily in water, so they release most of their hydrogen ions into the solution, and the presence of a lot of hydrogen ions in the solution makes the solution acidic. All right, and weak acids, on the other hand, do not ionize completely. So the weak acids only dissociate partially in water, but they keep most of their hydrogen ions chemically bound. So weak acids don't drastically affect pH. Let me show you an example of a weak acid. Okay, let's just see HCl first. HCl in water will form H plus and Cl minus. So they have dissociated completely. Okay, but another example like H2CO3, this is carbonic acid. When carbonic acid dissolves in water, it breaks down into H plus and HCO3 minus. So you can see that it still has one of the hydrogen ions bound to the carbonate. So H2CO3 is considered a weak acid because it does not dissociate completely in water. Okay, so carbonic acid does not affect pH much. And then you have bases. Bases are the chemicals that accept a hydrogen ion. And when you have strong bases like a hydroxide ion, they have a strong tendency to bind to hydrogen. So if you have a strong base like OH minus in the solution, they're going to combine with H plus to make H2O. So hydroxide ion is a strong base. So Bicarbonate ions, yeah, I have it over here. I need space to write. So a good example of a weak base is, again, bicarbonate ion. Bicarbonate ions combine with H+, but they bind to H+ only sometimes, okay? And they don't have too much effect on the pH. So bicarbonate ion over here is a weak base, and carbonic acid is a weak acid. Okay, so this is carbonic acid and this is bicarbonate. Our body needs to have a certain pH for us to be alive. Okay, but the normal pH range in the body is 7.35 to 7.45. Anything below 7.35 will be considered acidic for the body, and anything above 7.45 will be considered alkaline or basic for the body. Okay, but some fluids like the stomach acids range in between 1.5 to 3.5 or 1 to 3. Different books write different numbers for this, and cerebrospinal fluid in the brain and spinal cord are at about 7.32 pH. Okay, so pH is really the measurement of hydrogen ions in a solution. And so why do we need an optimum condition for the body? Why do we need a certain range of pH for the body? That is because the metabolic reactions in the body are most active at a certain range of pH. Okay, now the stomach acid, for instance, are active only in pH in between pH 1 to pH 3. The enzyme in our body function at a certain pH, okay, and that's why we need an optimum range. Okay, this range 7.35 to 7.45 is the range for blood and tissue fluid. Stomach is at about 1 to 3, and cerebrospinal fluid is approximately at about 7.32. And cerebrospinal fluid specifically is very, very sensitive to any change in pH. Okay, so all these different areas in the body need an optimum condition for the metabolic reaction to occur properly. Now, what would happen if there's any disruption in pH? Let's take an example of milk. If you take some milk and pour some vinegar or lemon juice in the milk and set it aside for 5 minutes, the milk curdles. That's because the proteins in the milk, like casein, these proteins unfold, causing the proteins to lose their properties. And that process is known as denaturation. Denaturation. The same thing would happen to the proteins and enzymes in our body if the pH becomes too acidic or too basic. And for this reason, we have buffers in our body. Buffer is something that can resist a change in pH upon the addition of an acid or the addition of a base. So what is an acid? Acid releases hydrogen ion in solution, and a base is a chemical that accepts a hydrogen ion in solution. Okay, so the buffer is a chemical that combines with either the hydrogen ions to maintain acidity or releases hydrogen ions to maintain the pH. Okay, so the concentration of hydrogen ion tells us how acidic or basic a solution is. So why do we need buffers? That is because basic biochemical reactions due to metabolism constantly produce acids. The types of acid we produce are lactic acids from anaerobic fermentation Anaerobic fermentation, meaning fermentation in the absence of oxygen. So when we don't have enough oxygen to make ATP, we produce pyruvic acid and lactic acid, and then we produce phosphoric acid from nucleic acid catabolism. So when we break down nucleic acids, we produce phosphoric acid, and then we produce fatty acids and ketones that contribute to acidity when we break down fats. If you don't have enough glucose, your body is going to start utilizing fat for energy, and as a result, we produce fatty acid and ketones. And then we have carbonic acid. Carbonic acid. Now, carbonic acid is obtained from carbon dioxide. When we breathe in carbon dioxide, the CO2, sorry, did I say breathe in? If you don't breathe in carbon, when we breathe in oxygen and when the cells release carbon dioxide as a result of chemical reaction, the CO2 combines with water in the body to make carbonic acid. Now, carbonic acid, so this over here is carbonic acid. Carbonic acid is a very important, and the most common buffer in the extracellular fluid. Okay, so this carbonic acid can release hydrogen ions to maintain pH. Let's see how. So carbonic acid is a weak acid. An acid is anything that can donate hydrogen ions. And if we don't have enough hydrogen ions, carbonic acid, which is a buffer, this can split into H+ ions and HCO3 ions. Remember, the concentration of hydrogen ions dictate the pH, okay? And then we have weak acids that do not split completely. So carbonic acid is a weak acid that splits up into hydrogen ion and bicarbonate ion. So this one over here is bicarbonate ion. So this is a hydrogen ion. So when we don't have enough hydrogen ions, carbonic acid splits into hydrogen and bicarbonate ion. So we have a weak acid that does not split completely. So now we have hydrogen and bicarbonate ion. And bicarbonate ion is a weak base. Why is it a weak base? Because bicarbonate ion combines with the hydrogen ion if we have too much hydrogen ions in the solution to form carbonic acid again. So this is a reversible reaction, okay? Now I repeat, when we don't have enough hydrogen ions, I'm going to pull up my pointer right out here. When we don't have enough hydrogen ions, carbonic acid, which is a weak acid, splits to form hydrogen and bicarbonate. Bicarbonate is considered a weak base because when we have too many hydrogen ions, bicarbonate combines with hydrogen ion to form carbonic acid, which is what we originally began from. So where do we get carbonic acid from? We just talked about it. The carbon dioxide in the cells, so CO2, that is a byproduct of cellular respiration, combines with water in the body fluids to form carbonic acid. So let's think about it for a second. If you are acidic, meaning if you have too many hydrogen ions that are present in the solution, bicarbonate ion is going to combine with hydrogen to form carbonic acid. The carbonic acid can then split up again into carbon dioxide and water, and then we breathe out carbon dioxide, right? And this is one way we can make our body fluids more alkaline if we have too many acids. Okay, and when we have too many hydrogen ions, we want to form carbon dioxide eventually and get rid of carbon dioxide as much as we can. So we breathe faster. So we hyperventilate in order to release all the excess carbon dioxide. Why? Because if we have too much carbon dioxide in our body fluids, the carbon dioxide is going to combine with water to form a weak acid, which is carbonic acid. And the carbonic acid will split into hydrogen and bicarbonate to lower the pH. Okay. So there's one way we can increase hydrogen ions if we are alkaline is by holding our breath. If you hold your breath and if you breathe shallow and slowly, the carbon dioxide will get retained in our body and will form a lot more bicarbonate ions and hydrogen ions from carbonic acid. So just keep this in mind. We will revisit this again at the end of the chapter. We have different buffer systems. We have chemical buffers or physiological buffers. As the name suggests, chemical buffers are chemicals and they restore normal pH in a fraction of a second. Okay, but physiological buffer are the types of buffer system wherein the organ systems are involved. So physiological buffer system takes longer to kick in. Now, the buffer system are mixtures of weak acid and weak bases. So a buffer system that we just looked at was a bicarbonate buffer system. Bicarbonate buffer system is the most common buffer in the extracellular fluid, and the protein buffer system is the most common buffer in the intracellular fluid. Now, the chemical buffers respond instantly, which is good, but we have a limited supply of chemicals. So it will provide, an instant fix, but it is not long lasting because we can exhaust all the, chemicals in the body. Okay, so physiological buffer system provide a long-term fix, but they do not respond instantly. They take sometimes several hours or several days to completely restore the pH. So we just looked at the bicarbonate buffer system. The bicarbonate buffer system is sometimes called the carbonic acid bicarbonate buffer system. Now, if you remember what we just talked about, H2CO3 is a carbonic acid. When our body is alkaline, carbonic acid will split into H plus and HCO3 minus to release H plus ions and make the pH more acidic. And if our body becomes too acidic, the weak base over here, which is bicarbonate ions, combines with the excess H plus ions to form H2CO3. And H2CO3 is capable of splitting into H2O plus CO2, and then we release or breathe out excessive CO2. Okay, and this is also a reversible reaction. Now, the second buffer system is the phosphate buffer system. This system is present in both intracellular and extracellular fluid, and they are very important in controlling the pH of nephrons, and they're important in controlling the pH of erythrocytes. So you find the phosphate buffer system in erythrocytes, and then you have protein buffer system. The protein buffer system consists of plasma proteins and a lot of cell proteins. When the pH falls, the amino groups of the proteins the amino groups of the proteins accept hydrogen ions. Okay, we'll look at it in just a second. So the main buffer that we'll be focusing on is the bicarbonate buffer system. All right, so the physiological buffer system is where the organ systems kick in. The main organ systems that are involved in maintaining the pH of the body are urinary system and respiratory system. Now, the physiological buffer kicks in when we run out of the chemical buffers. And these are the organ systems that maintain pH. Now, the lungs respond more rapidly because when we exhale CO2 from the body, the lungs compensate by handling the CO2. Okay, so if we want to make more hydrogen ions, we're going to retain, or we can hold our breath to retain carbon dioxide and produce more hydrogen ions. But if our body needs to get rid of hydrogen ions, we can breathe out CO2 to lose excess CO2. Okay, so we don't make a lot of hydrogen ions. So that is one way we can control the pH. When the chemicals in the lungs fail, the kidney takes over. The kidneys excrete whatever is in excess, but the process takes time. The kidneys can deal with hydrogen ions or bicarbonate ions, but kidneys are a longer fix. They are more permanent fix, even though they are slow and steady. Okay, so I'm going to write this down. To lower the pH, kidney excrete HCO3 minus ions because this is a weak base. Okay, and to raise the pH, kidneys excrete hydrogen ions because you don't want hydrogen ions if you're trying to make your fluids more alkaline. Okay, so to raise the pH, kidney excrete H plus ions and the lungs excrete CO2 because CO2 combines with water to make carbonic acid, but again splits to release H plus ions. Okay, so these are the two organ systems that can compensate for any disturbance in pH of the body. The bicarbonate buffer system is the most important buffer system and the most common buffer in the extracellular fluid. So I am going to repeat myself a few times because you need to understand how this buffer works. So remember one thing. Remember, more hydrogen ions, so higher amount of hydrogen ions leads to acidity. And acidity is really low pH. Okay? And then if you have a low amount of hydrogen, it leads to alkalinity or basicity. And basicity is really increased pH on a pH scale. Okay? So keep that in the back of your mind. So let's see how the bicarbonate ions works. Here it's typed, so you won't have to read my horrible handwriting. When your pH is okay, so when your pH is too high, you breathe slowly. You breathe slowly, and every time you breathe slowly, you're not removing much carbon dioxide. So the body retains carbon dioxide, combines with water to form carbonic acid. This carbonic acid splits into bicarbonate ion and hydrogen. So the presence of hydrogen leads to decrease in the pH. Okay? Now, if your pH is too low, it means you have too many hydrogen ions and you want to get rid of them. And where do you get these hydrogen ions from? You get it from the carbon dioxide and water to begin with. Right? So when your pH is too low, your lungs hyperventilate. So you breathe faster to remove excess CO2. Okay? So less CO2 means that you'll not have enough CO2 forming carbonic acid. Okay? So when you have too many hydrogen ions, the excess hydrogen ions combine with bicarbonate to form carbonic acid. The carbonic acid then splits into water and carbon dioxide. And then you breathe out carbon dioxide to maintain the pH. So this is called compensation. Okay, how does a lung compensate for change in pH? And this is what we do all the time. The phosphate buffer system works in both extracellular fluids and intracellular fluids. And these buffers are very important in controlling the hydrogen ion secretion from nephron. And they're very important in maintaining the pH in erythrocytes as well, meaning red blood cells. Now, the phosphate buffer system is made up of hydrogen phosphate and dihydrogen phosphate. Okay, and the protein buffer system is the most common buffer system in the intracellular fluid. The proteins are more concentrated than bicarbonate or phosphate because they have a whole bunch of carboxyl and amino groups. And the plasma proteins and cell proteins are the ones that make up the protein buffer. When the pH falls below 7.35, the amino groups which are present in protein combine with hydrogen to maintain homeostasis. Okay? And this way we can restore the pH range. And when the pH is alkaline or it shoots above 7.45, the carboxyl side groups combine with hydrogen ions to raise the pH and make the pH more alkaline. So there are two types of acid-base disorders broadly. We have acidosis and alkalosis. Acidosis is a condition where the pH of the extracellular fluid falls below 7.35. So acidic solution, meaning there are too many hydrogen ions. So when a person has acidosis, the hydrogen ions diffuse into the cell, and in exchange, they drive out potassium ions. If you remember from the urinary system, in a cell, hydrogen and potassium shift in the opposite direction. So this raises the concentration of potassium ions out of the cell, and the hydrogen ions inside the cell is neutralized by the negative charges inside the cell. Okay, so this causes the cell to hyperpolarize, meaning too much polarity, because it remains near neutral inside, but the extracellular fluid constantly has an increasing concentration of potassium ions. So the cells get hyperpolarized, and hyperpolarized nerve and muscle cells are very hard to stimulate. And when the pH falls below 6.8, central nervous system may get depressed, and it may lead to confusion, disorientation, and in extreme cases, coma and death. Okay. Now, the other thing of interest in acid-base disorders is the anion gap, specifically in acidosis. An anion gap is the sum of routinely measured cations, which are sodium and potassium, minus the routinely measured anions, chloride and bicarbonate. You don't have to read too much into this, but just understand that when you have a high anion gap, it means you have too much organic acid, and we can use the anion gap to figure out which anion is actually causing the problem. When a person is said to have a normal anion gap, that is due to normal loss of bicarbonate ions, but we won't worry about this too much just yet. Alkalosis is the opposite of acidosis. Alkalosis is a condition above a pH 7.45. When a person has acidosis, we have not enough. Sorry, did I say acidosis? When a person has alkalosis, the pH is above 7.45, and there's not enough hydrogen ions in the extracellular fluid. And due to this, the hydrogen ions from inside of the cell diffuse out, and potassium ions diffuse into the cell. So this causes the cells to be depolarized, meaning they become more positive. They lose the polarity and the membrane potential shift towards zero, and the cells become overstimulated, causing muscle spasm, tetany, convulsions, and death due to respiratory arrest eventually. So both of these conditions are really harmful, and a person cannot survive for more than few hours if the pH falls below 7 or above 7.7. Acid-base imbalance, lost my pointer again. So acid-base imbalance can be of two types. We can have metabolic acidosis or metabolic alkalosis, and then we have respiratory alkalosis and respiratory acidosis. Okay, so keep in mind, if the chemical buffers fail and if the lungs fail, that's when kidneys kick in, and anything to do with metabolic acidosis or alkalosis would have something to do with kidney. Okay, and respiratory acidosis or alkalosis is due to some problem with the lungs. Okay, yes, baby. So metabolic acidosis is the acidosis wherein we can have so many different causes. During metabolic acidosis, well, we see a reduce in the pH of the body fluids, and this can be due to increased production of organic acids like lactic acid. When we undergo anaerobic respiration instead of aerobic respiration, we produce too many lactic acids, and we also see metabolic acidosis due to starvation, or in really serious alcoholics, you'd see acidosis because when you drink too much, it leads to a byproduct of acid, right? So when we drink so much, we produce lactic acid, and we also pee a lot. So the combination of two leads to acidosis because we lose a lot of bicarbonate ions when we pee. So the combination of two leads to acidosis. And when we drink a lot and we don't eat properly, we end up utilizing fat as a source of energy. And when fats break down, ketone bodies are produced, and these ketone bodies also contribute to acidosis. Okay, and then when a person will undergo starvation, and in conditions like diabetes, type 1 diabetes, you've heard of diabetic ketoacidosis. So diabetic ketoacidosis can cause acidosis when you starve and when you don't take your insulin medication. Without food or insulin, your body begins to break down fat as fuel, and as a result of fat breakdown, ketone bodies, which is right over here, are produced as a byproduct. And this increases acidity of the body fluids. And the other condition that can cause to Well, metabolic acidosis is excessive diarrhea when we lose a lot of bicarbonate ions and overuse of laxatives. Some drugs like aspirin also cause acidosis. Okay, so when acidosis kicks in, the lungs try to compensate first because we want to lose excess CO2 just so the CO2 doesn't lead to formation of hydrogen ions from carbonic acid. So we rapidly breathe. This is called Kussmaul breathing or Kussmaul respiration. Okay, so when we release or breathe out excess CO2, we lose a lot of CO2, so that helps in preventing more hydrogen ions from being released into the body fluids. Let me remind you, alkaline substances or basic substances have low concentration of hydrogen ions and high concentration of bases like bicarbonate ions. So metabolic alkalosis is a less common form compared to metabolic acidosis, and it results from excessive loss of hydrogen ions or excessive gain of bases or bicarbonate ions. Now, in metabolic alkalosis, there's an increase in the pH of blood beyond 7.45, and that is called alkalemia. Oh, not working. Alkalemia. So when the pH of blood is above the normal range of 7.45, it's called alkalemia. And this can happen due to, after gastric drainage, or it's called lavage, when they empty the gastric juices. And it can happen due to a certain diuretics when a person pees a lot, and then it can happen due to overuse of antacids. So if you overuse antacids and bicarbonate solution, you basically neutralize the acids in your stomach. And why is this important? Because these gastric juices, when you remove them or neutralize them, it leads to something called as an alkaline tide. An alkaline tide is caused by bicarbonate ions that are, so these are HCO3 minus. The bicarbonate ions move from the cell into the extracellular fluid, and bicarbonate ions are a weak base. So when you have a weak base moving into the extracellular fluid, it causes increase in pH. Okay. And a solution with a high pH is called a base or an alkaline solution. And some other conditions that can lead to metabolic alkalosis include excessive vomiting. When you vomit too much stomach acids, this can lead to higher bicarbonate ions in the extracellular fluid. Now, so how does metabolic alkalosis get compensated? So compensation is just a response. It does not mean it's correcting the problem. It is just a response by the kidney and by the lungs. Okay, so during metabolic alkalosis, the kidney responds by increasing. So the kidney is going to increase the excretion of bicarbonate, and it's going to decrease the excretion of hydrogen ions to increase acidity. And then what could happen? The lungs, right? So the lungs also compensate by slow, shallow respiration. When you perform slow, shallow respiration, you retain carbon dioxide in the bloodstream, and this carbon dioxide combines with hydrogen, water to form carbonic acid. And that carbonic acid will break down into H plus ions and HCO3 minus ions. And this H plus ions will contribute to increasing the acidity of the bloodstream. So another condition which can lead to metabolic alkalosis is, which I forgot to talk about, hyperaldosteronism. So if you remember, aldosterone is a salt-retaining hormone, meaning it retains sodium. And in the nephron tubule, when you retain sodium, you end up losing potassium and hydrogen ion to the urine. So when you don't have enough hydrogen ions, it leads to alkalosis. Now, if for all these conditions, acidosis or alkalosis, they treat the cause. You cannot treat the condition, alkalosis or acidosis itself, without knowing the cause. So they actually treat the cause. For example, if it's a case of mild vomiting, they usually focus on controlling the vomiting or any other causative factor. Okay, and if vomiting couldn't be stopped, they're going to administer sodium chloride solution and potassium chloride solution, and both of these solutions will be isotonic to the osmolarity of the body fluids. Now, in case of acute alkalosis, what was given? Ammonium chloride is administered in case of acute metabolic alkalosis, and the ammonium ions break down into hydrogen ions, which quickly diffuses into the bloodstream to lower the pH in case of acute alkalosis. Oh, where's my pointer? So yeah, respiratory acidosis can be caused by really high levels of carbon dioxide and high levels of carbonic acid. So both things can be observed over here. But usually when you see a really high level of PCO2 beyond 45 mm of mercury is when the condition is called respiratory acidosis. And this condition leads to really high level of CO2. So this is known as hypercapnia, meaning hypercapnia, high levels of CO2. And this can be due to either the injury to the brainstem that affects the respiratory center that decreases breathing. When you decrease breathing, you are unable to remove carbon dioxide efficiently, or it can be caused due to COPD. COPD is just an umbrella term, and emphysema, severe pneumonia, all of these are a type of COPD. Chronic obstructive pulmonary disorder, okay? But this is just an umbrella term used for so many different lung conditions. And emphysema is a type of COPD wherein the alveoli of the lung is overinflated and it's eventually damaged or destroyed. And because of, destroyed alveoli, you cannot efficiently remove carbon dioxide, which leads to higher levels of CO2 in the arteries, okay? And PCO2 is basically a measurement of carbon dioxide using arterial blood gas measurement. Okay, and then again in pneumonia, the alveoli fill with fluid that causes the lungs to function inefficiently, and we retain a lot of carbon dioxide. Okay, but keep in mind, in respiratory acidosis, the main cause is increase of PCO2 beyond 45 mm of mercury. However, this will lead to high PCO2 levels as well as high bicarbonate acid levels, okay, or carbonic acid level, because if you retain CO2, it will combine with water and form carbonic acid, okay? So in respiratory acidosis, you're looking at the arterial blood gas, okay, mainly. And how does the lung behave in respiratory acidosis? Obviously, when you look at a person breathe, you can tell what type of condition it is, whether it's acidosis or alkalosis. So person with respiratory alkalosis has chest congestion, so they have very slow, shallow respiration, and the kidneys try to compensate by removing um, well, let's see. Sorry about that. So yeah, so the kidney try to compensate by excreting more hydrogen and more resorption of bicarbonate ions, so we can increase the pH of the body fluids. Okay, when I say body fluids, really the blood, it's the extracellular fluids. Okay, and what else? Right. So the next type of acid-base disorder is, one more thing about respiratory acidosis. Oh no, I mentioned the type of breathing. Okay. All right, so let's move on to respiratory alkalosis. Respiratory alkalosis is caused when the PCO2 level is below 35 mm of mercury. Okay, so this is really, really low. So respiratory alkalosis is a less common condition, not so common like respiratory acidosis, and it creates a condition known as hypocapnia. Okay, hypocapnia. I should write that down. Better write it down over here. It creates hypocapnia, meaning really low levels of carbon dioxide. Okay, and respiratory alkalosis is caused when you have a panic attack and then you breathe out too much air. So when you hyperventilate due to a panic attack, okay, and that will cause you to hyperventilate. And that causes excessive removal of carbon dioxide from the body. And when you remove too much carbon dioxide, you do not have enough hydrogen ions because you don't make enough carbonic acid. Okay, so this results in increase of pH. That is called alkalosis because the pH increases. So think of what do you do when a person hyperventilates? You hand them a paper bag and they breathe into a bag, and when you breathe into a bag, eventually the bag fills up with carbon dioxide that you breathe out, and at some point the person who's breathing into the bag breathes in carbon dioxide instead of air to level out the pH, right? So really breathing carbon dioxide. Once you have enough carbon dioxide and you make enough acids, the level of pH is returned to normal, which is 7.35 to 7.45. So really, respiratory alkalosis is the opposite of respiratory acidosis. So what do you see? You see decreased levels of PCO2, and then how does the kidney compensate? The kidney will compensate by reducing hydrogen secretion or excretion, okay? And then it will also, reduce the absorption of, reduce absorption of bicarbonate. Okay, because bicarbonate is a base, and if you have alkalosis, you don't want a base. You want hydrogen ions to level out the pH. Okay, so you want acids. Okay, so the kidney is going to reduce hydrogen ion excretion, and it is going to decrease the absorption of bicarbonate ions. Okay, so this is what happens in respiratory alkalosis. And keep in mind, acidosis will be just the opposite of respiratory alkalosis. Let's look at this equation again. Now, to make carbonic acid, you need carbon dioxide and water. So when you breathe in and breathe out and you make carbon dioxide, we make the required amount of carbonic acid and we exhale what is not necessary, okay, to maintain optimum pH. And this carbonic acid splits into bicarbonate ion and hydrogen ion. Hydrogen ion leads to, the concentration of hydrogen ion determines the pH. Okay, so what happens in acidosis in general? In acidosis, you have too much hydrogen ions, so the equation shifts towards the left. Why? Because the excess hydrogen ions combine with bicarbonate ions to make carbonic acid. Okay, and then carbonic acid breaks into carbon dioxide and water in order to compensate, and then we breathe out CO2. So when we have acidosis, we breathe faster, and that's how lungs compensate. Okay, now if the kidney compensate in acidosis, they retain bicarbonate ion and they secrete more hydrogen ions to fix the pH. Now the alkalosis is going to be the exact opposite of acidosis. In acidosis, the equation, so this equation is what we are talking about, the equation shifts to the right. So in alkalosis, keep in mind, we have too little hydrogen ions. So in order to compensate, we need to make more hydrogen ions. And that's why the equation shifts to the right. So in alkalosis, we breathe slowly. And when we breathe slowly, we retain carbon dioxide. When we retain carbon dioxide, we make more carbonic acid, which splits to produce hydrogen ions. And hydrogen ions leads to increase in the pH. Okay, and that's what you need. So this is talking about compensation. So this is how bicarbonate buffer system helps in maintaining homeostasis in pH. Okay, so how do you treat a patient with acidosis or alkalosis, now, or even loss of fluid? So fluid replacement therapy is the easiest method, but water alone does not help. It does not replace electrolytes. So depending on whether it's alkalosis or acidosis, they're going to provide, IV treatment with maybe sodium chloride or potassium chloride or ammonium chloride, depending on the condition. And so the other way they can treat a patient is by, what is that called? Parenteral route. That's a route. Okay, so a parenteral route is fluid administration in an area of the body other than digestive tract. Okay, so it can be IV, it can be a subcutaneous route, it can be intramuscular injection. So anywhere other than oral cavity where we're injecting maybe fluid, it's called a parenteral route. Okay, so patients who cannot eat are given isotonic glucose solutions if they need to be given a glucose solution. And sometimes excessive blood loss occurs, and that is quickly corrected or treated by given isotonic sodium chloride solution. Now, isotonic solutions are important because isotonic solution will have the same osmolarity as your body fluids. Okay, and then you can raise the blood volume while maintaining osmolarity. Okay, now now, in case of excessive blood loss, it can, if you give too much saline and if the person loses too much blood, it can cause hypernatremia or hyperchloremia, right? So keep in mind, that's the reason you study osmosis, and that's the reason you make sure an isotonic solution is given to the patient. When a person has acidosis, they are given something called as Ringer's lactate. So Ringer's lactate is the solution used because the byproducts are basically it has lactate. So the byproducts are going to be lactate metabolism products in the liver. So these byproducts counteract acidosis. Okay, so this treats the chemical imbalance during acidosis. Alkalosis can be treated with potassium chloride, but again, you never bolus potassium chloride. It is given to the patient really slowly because potassium chloride can have really drastic effects on cardiac rhythm. The person can go into, fibrillation and die instantly within a matter of minutes. So a lot of times, potassium chloride is given, but you can also give saline with high chloride content, and this sometimes can cause renal vasoconstriction, meaning constriction of the blood vessels and in the kidney, so renal vasoconstriction. So when this happens, it affects the blood flow to the kidney. So there's always no direct way of treating a patient. You not only consider the concentration of electrolytes, but you also keep in mind the general condition of the patient. So this is just an overview of, fluid replacement therapy for patients, and I hope you have a general idea of respiratory acidosis and alkalosis in general, okay? And metabolic acidosis and metabolic alkalosis. So just keep in mind, anything to do with respiratory acidosis will have something to do with the lungs. Anything to do with metabolic acidosis will have something to do with the kidney. And with respiratory acidosis, you're looking at the arterial carbon dioxide levels. Okay, but with metabolic acidosis, you observe the bicarbonate levels and the respiration of the patient. Okay, so just keep this in mind. And this is where we complete chapter 24. Fluid, electrolytes, acids, and bases.